Cryohaemolysis test is used as a specific test in the diagnosis of hereditary spherocytosis, because unlike in osmotic fragility, this test is not positive in any condition of spherocytes. So, if I explain the principle of the test, as I mentioned before, it is specific for HS as it depends on the molecular defects of the red cell membrane rather than to changes in surface area to volume ratio. In this test, what we do is the red cells are tested their ability to withstand cold temperature. Normal red cells can withstand cold temperature to a certain extent, but spherocytes in HS, because of their molecular abnormality in the membrane, cannot withstand cold temperature like normal red cells. So, in this test we use EDTA blood, and first we make a red cell suspension, washed red cell suspension using cold sodium chloride. For that suspension, we add the reagent. Reagent is a sucrose solution in phosphate buffer. After adding the reagent, we incubate this mixture for about 10 minutes at 37, and immediately you have to transfer this mixture to ice bath, and we keep it for 10 minutes. After that, we centrifuge and we observe the supernatant, and the supernatant will look like this. So, this is how the supernatant look like. This is the normal and this is the test. But usually, unlike in osmotic fragility, there won't be clearly visible color change in the test. What we have to do is we have to measure the optical density or the absorbance, and we have to calculate the percentage hemolysis like this. So, we have to take the percentage of like this optical density or the absorbance of the test, and when we have to compare, or we have to take a fraction it as the comparison of the 100% hemolysate. With this percentage, we have to interpret the test. Cryohaemolysis is in normal subjects is usually within 3 to 15% range, whereas in hereditary spherocytosis it's about 20% lysis. So, usually this is considered as a specific test in Sri Lanka. As we have limited facilities for membrane studies, we use this cryohaemolysis test to diagnose patients with HS.